Hello, everybody. Today's session, we shall be discussing about alpha blockers. The topic shall be discussed under the following headings: the classification of alpha blockers. Then we shall see in general the mechanism of action, actions, uses, and adverse effects of alpha blockers. And finally, towards the end of the topic, we shall be discussing about some special features about important alpha blockers. So before we go into the topic, we shall have a recap of the normal responses of the alpha receptors. So as you know, we are having two types of alpha receptors, that is alpha 1 and alpha 2. The functions of alpha 1 includes vasoconstriction, contraction of radial muscles of iris leading to mydriasis, bladder trigone contraction, intestinal smooth muscle relaxation, and a less important function, that is the liver glycogenolysis. On the other hand, alpha-2 receptors is concerned with vasoconstriction, just like alpha-1 receptors. It causes a decreased NA release from the nerve terminal because it's an autoreceptor. It causes decreased central sympathetic outflow. It causes a decreased insulin release, and it also has a minor function on platelet aggregation. Now, this is very important. This is a core thing that you have to remember in order to understand the alpha blockers. Once you know the functions of alpha receptors, the rest of the topic becomes very simple for you to understand. So now we'll discuss the classification. Now this you have to learn by heart. So the alpha blockers are divided into two types. That is a non-equilibrium type, which includes the beta haloalkylamines, example, phenoxybenzamine. And the other broad category is the equilibrium type, that is further divided into the non-selective alpha blockers and the selective blockers. So among these two categories, that is a non-selective and the alpha-1 selective blockers, the selective blockers are therapeutically more important. So just let us name the blockers. The ergot alkaloids, example is ergotamine, ergotoxin, hydrogenated ergot alkaloids, dihydroergotoxin, then dihydroergotamine, imidazolines, examples are tolazoline, phentolamine, and the miscellaneous group we are having the chlorpromazine. Then the selective ones, these are very important. You have to pay attention to these blockers. The alpha-1 selective blockers includes drugs like prazosin, terazosin, doxazosin, alfuzosin, and tamsulosin. The alpha-2 selective blockers include mainly the yohimbine. Now let us see the mechanism of action. So the mechanism of action of alpha blockers is to inhibit the adrenergic responses mediated through the alpha receptors. And by now you already know the responses of the alpha receptors. So it becomes very simple for you to say the actions of the alpha blockers. For example, on the blood vessels, you know the normal response of alpha-1 and alpha-2 receptors is vasoconstriction. So the response of the alpha blocker is to inhibit the vasoconstriction response of the alpha receptor. So we may prefer to say it as vasodilatation, but we would not opt to say vasodilatation. We would opt to say that it inhibits the vasoconstrictor response of alpha receptors. Now let us see the actions of alpha blockers. The first and foremost, the effects on blood vessels. So it blocks the vasoconstrictor alpha receptors on the blood vessels, which leads to obviously vasodilatation. And because of the vasodilatation, there is a pooling of blood in the veins of the lower limbs. And when this happens, there is a decreased venous return. And as a consequence, you have a decreased cardiac output, which leads to a fall in the BP. So this is the main action of alpha blockers on the blood pressure. It causes a fall in the blood pressure. And I've told you already the explanation how it is causing the fall in the BP. Now, on the heart, it causes the reflex tachycardia. Now, this reflex tachycardia is occurring as a reflex response to the fall in the BP. So what happens here is that there is a stimulation of beta-1 receptors on the heart because of the fall in the BP that has been caused by alpha blockers. That is the reason why it is called as a reflex tachycardia. It's a reflex response to the fall in the BP. Then its effects on the kidney. Now, because of the fall in the BP, there is a reduced renal blood flow to the kidney, and this leads to more complete sodium and water reabsorption as a response by the kidney, and this causes edema. So, fall in BP reflects tachycardia and edema. These are the principal actions so far discussed. The other actions include nasal stuffiness. Now, this occurs because of the blockade of the alpha receptor mediated vasoconstriction of the blood vessels in the nasal mucosa. So, what happens is that when there is you have the vasoconstriction of the blood vessels of the nasal mucosa is being inhibited, obviously it gets dilated and there is a lot of secretion that is happening which causes the nasal stuffiness. Now meiosis, obviously you understand because of the blockade of the alpha receptor mediated mydriasis, and obviously the intestinal motility is increased again because of the blockade of the relaxin effects of alpha receptors. Now, the smooth muscles, this is very important. We have mentioned that it causes, the alpha receptors causes bladder trigone contraction. Now, when it is blocked, it causes a decrease in the tone of the bladder, the prostate, and the vas deferens, leading to improved urinary flow. And this strategy, because of this action of the alpha blockers, it can be preferred in BHP. You already know what happens in benign hypertrophy of prostate. Patients do have difficulty in passing the urine. And because these alpha blockers are having the ability to decrease the tone of the bladder by blocking the alpha receptors, it can be used for BHP. Now, what are the uses of the alpha blockers? So first and foremost use is in hypertension. And when we talk about hypertension, there are many other drugs which are much better than alpha blockers, which are being used nowadays. However, alpha blockers are still used, and among the alpha blockers also, it is the selective blockers like prazosin, terazosin, which are preferred for the treatment of hypertension. Then comes pheochromocytoma. So this is a tumor of the adrenal medulla, and there is a lot of secretion of catecholamines, and the patient presents with very severe hypertension. Now, alpha blockers are used in pheochromocytoma for symptomatic relief from hypertension. The alpha blocker which is preferred is a non-equilibrium type of alpha blocker, that is phenoxybenzamine. The other use, as I already mentioned, is benign hypertrophy of prostate, where principally you'll use the selective alpha blockers like prazosin, terazosin, tamsulosin, and all, because of their obvious action that I have discussed in the previous slide. Now, other uses which are less important as far as the alpha blockers are concerned is the use in secondary shock. So in secondary shock, there is a vasoconstriction which is being inhibited by the alpha blocker. The alpha blocker which is preferred for this use is phenoxybenzamine. Then the minor uses include the use in peripheral vascular diseases. Then it is also used to prevent the dermal necrosis caused by extravasation of noradrenaline. So I'll just expand this a little bit here. So when you administer noradrenaline, there has to be a precaution that it should not extravasate out of the cannula onto the normal skin. And if it occurs, there can be dermal necrosis because of the vasoconstriction of the blood vessels of the skin. That's caused by the noradrenaline. Now, if this occurs, the way to reverse it is to administer a very fast-acting alpha blocker, that is phentolamine. Now, phentolamine is also used to control hypertensive crisis, which is seen in patients who are having clonidine withdrawal or something called as a cheese reaction, which I'll be describing in one of the videos, separate videos. So phentolamine can be used in such cases also. Now, it is also used for migraine and short-term management of congestive heart failure. So these are the uses of the alpha blockers. The principal uses, however, remains hypertension, the benign hypertrophy of prostate, and pheochromocytoma. And the less important uses are the following. However, when you write in the exam, you have to mention all these uses for a good answer. Then we come to the adverse effects of alpha blockers. Now, we have mentioned, when you're mentioning the actions, you always have to remember that the actions of a drug may be used for therapeutic purpose. It can also lead to adverse effects. So we have seen that the vasodilatation that was being caused by the alpha blocker, that particular action was beneficial for it as a drug for hypertension. At the same time, the adverse effect can be postural hypotension. And the postural hypotension with alpha blockers usually occurs with initial few doses, and this is why it's called as the first dose effect. It often disappears with the subsequent doses. However, you have always take care to advise your patients to avoid sudden standing up from lying down position if they are on alpha blockers. If they are getting up from the bed, advise them to sit up on the bed first, then sit up with their legs down, and then slowly get up and then slowly start walking. It is always preferred to administer the drug at night times and always start the drug from a low dose in the beginning. These steps can help in overcoming or to avoid the postural hypotension and the subsequent effects of postural hypotension. Now, some patients complain of palpitation, and this is occurring because of the reflex tachycardia, nasal stuffiness, meiosis, inhibition of ejaculation, and salt and water retention, and hence edema are the other adverse effects of alpha blockers. Now, this is a very simple topic because once you understand the base, you can automatically build up the uses, the adverse effects, and it is very easy for you to remember if you get the base right. Now, we'll now discuss about some special features of individual alpha blockers. So phenoxybenzamine, it is a non-equilibrium type alpha blocker. It is a prodrug and it binds to the alpha receptors by irreversible bond. The uses of phenoxybenzamine I have already mentioned under the uses section of the alpha blockers. Now, phentolamine, the most characteristic feature of phentolamine, it is that it is the most rapidly acting alpha blocker with a short duration of action. Prazosin, it is a selective alpha blocker and it has got additional phosphodiesterase enzyme inhibitor property. Postural hypotension is very less compared to the other alpha blockers because it dilates the arterioles more than the veins. And there is little or no reflex tachycardia with prazosin. About the terazosin, it is again a selective alpha blocker. It has got a long T-half and hence you can give it in a single dose. It has got additional apoptotic activity on the prostate. Now, when you compare prazosin and terazosin, terazosin will be much preferred for the treatment of BPH as compared to prazosin because of mainly two reasons. That is, one is it can be given in a single dose, and second thing, it because of its additional apoptotic activity on the prostate. Now, doxazosin is again a selective alpha blocker. It is very long acting and can be given as a single dose for hypertension and BHP. Now, something that you have to remember about tamsulosin is that it is a uroselective alpha blocker. That means it is acting selectively on the alpha receptors present on the bladder. So you can prescribe this drug for BHP without causing a significant change in the blood pressure or heart rate. Now the question comes that can we prescribe terazosin and prazosin for the BHP? Yes, you can definitely prescribe both these things, but how these things will have an effect, these drugs will have an effect on the BP and heart rate also when you're prescribing it for the BHP. So if you have a patient who is having BHP and his blood pressure is quite normal, you can prefer to prescribe tamsulosin because it will act only on the bladder and will not have no effect on the blood pressure and the heart rate. Now, take for example another scenario where the patient has both BHP as well as hypertension. In those cases, you can prefer to use drugs like terazosin and prazosin, which will be beneficial both in BHP as well as in hypertension. Now, one of the ADRs of tamsulosin is retrograde ejaculation. So that was the class for alpha blockers. Now, tip for exam. The question that you can usually expect from this chapter are classification of alpha blockers, right actions, adverse effects, and uses of alpha blockers. So which is very easy, which I have discussed already in the initial slides. Often you get a topic, a short note like prazosin, and then you're clueless, what should we write? So for this drug, or for that matter, any drug that comes up in pharmacology, there is a simple mantra that you should follow. That is, you need to learn mainly about the prototype drug of each class of drug, and you learn the features of those the prototype drug, and you say the same thing in all the drugs, and can add the additional feature that is specific for that particular drug. For example, if you have to write prazosin, so you'll start your short note by saying that the class, the first about the class, that is, it is an alpha 1 selective blocker. And this you know from the classification. Mechanism of action, you already know because we have discussed it under the general features. Actions are the same as that is for any other alpha blocker. Uses also remain the same. ADR also remain the same as for any alpha blocker that we have discussed. And the additional, the special features you can mention of it having additional phosphodiesterase activity, and that it has got less first dose hypotension and less of reflex tachycardia. So for any drug, you always mention these the headings as follows. So it becomes very easy for you to write a short note on any other drug. Often students have difficulty in by hearting everything about every drug. So this is a mantra. You learn about the general features, that is mainly the mechanism of action, actions, uses, and ADR of the class in general, or the prototype drug in general, and you apply the same thing for all the drugs in that class, and you just need to add the special feature of that particular drug when you're writing a short note. So that's all for today's class. Thank you all for your patient hearing.